We have always thought about lasers in terms of rejuvenation and wrinkles. But what we are learning now is that laser restores skin health. Doing laser resurfacing can decrease the risk of developing non-melanoma skin cancer by 30%. The concept of face yoga is that if you exercise your muscles, you are exercising your skin. But on the contrary, when we do excessive movements with our faces, we are just pulling down on our faces. So face yoga, there's no science to it. It's just an Instagram trend.
How often should you be getting screened by your dermatologist, and what can you be looking for yourself for early signs of, perhaps skin cancer detection, so you know to get to the dermatologist?
Dr. Sara Cherem
is a board-certified dermatologist and laser expert transforming the future of skin health with science, precision, and innovation.
Trained at world-class institutions like Harvard, Hospital Clinic in Barcelona, and Hospital General de Mexico.
She specializes in advanced laser treatments that work at the molecular level, targeting everything from pigmentation and scars to aging and full skin rejuvenation.
As the founder of the Skin Clinic and a member of leading dermatologic societies,
Dr. Cherem is redefining what's possible in skincare by merging technology, wellness, and evidence-based medicine to help people truly understand and love their skin.
Everybody should have a full skin check once a year. Anything that doesn't heal is something we should check. And in terms for moles, we have the ABCDA. This is the ABCD of melanoma. A is...
Are there certain things that women can be doing in menopause? And what are your thoughts on using topical estrogen on the skin?
The lack of estrogen will make your skin be...
Welcome back to the Dr. Brighten Show. I'm your host, Dr. Jolene Brighten. I'm board certified in naturopathic endocrinology, a nutrition scientist, a certified sex counselor, and a certified menopause specialist. As always, I'm bringing you the latest, most up-to-date information to help you take charge of your health and take back your hormones. If you enjoy this kind of information, I invite you to visit my website, drbrighten.com, where I have a ton of free resources for you, including a newsletter that brings you some of the best information, including updates on this podcast. Now, as always, this information is brought to you cost-free, and because of that, I have to say thank you to my sponsors for making this possible. It's my aim to make sure that you can have all the tools and resources in your hands and that we end the gatekeeping. And in order to do that, I do have to get support for this podcast. Thank you so much for being here. I know your time is so valuable and so important, and it's not lost on me that you're sharing it with me right now. Don't forget to subscribe, leave a comment, or share this with a friend because it helps this podcast get out to everyone who needs it. All right, let's dive in. Dr. Sara Cherem, welcome to the show.
Thank you for having me. It's a pleasure.
Yes, I'm super excited. We are going to be getting into all things skincare health, anti-aging, covering what menopausal women can do, what everybody can do. And we're going to talk lasers later on. But my first question is, what is something that we're all doing for our skin that we think is so great, but it actually isn't?
So number one would be to solely rely on skincare to get actual results.
Okay.
When we talk about rejuvenation, this is a word that gets thrown around for everything.
Mm-hmm.
And a moisturizer won't do it.
Okay.
Number two would be to overutilize skin products and layer very potent actives one over the other, because this just leads to inflammation.
Oh, okay.
And inflammation is part of aging, so we speed up the process.
Mm-hmm.
Number three, skipping sunscreen, tanning, sunbeds, all of the above are like the worst we can do to our skin. Smoking.
Mm-hmm.
Smoking is 8 times worse than the sun.
Yeah.
We're always talking about the sun.
Mm-hmm.
Smoking is actually 8 times worse.
Gosh.
And what it does is our blood vessels, our skin is very smart.
Mm-hmm.
It doesn't want all the toxins from the tobacco to get into your skin. So what it does is it shuts the blood vessels.
Okay.
So you don't get all the toxins in.
Mm-hmm.
But in the process, you don't get any oxygen in and you don't flush out all the toxins.
Okay.
So smoking is horrible. And I would also add face yoga to it.
Face yoga. Okay, you're going to have to give us the why behind that, because I think a lot of people think this is like the latest and greatest thing that can totally reverse aging.
So the concept of face yoga is that if you exercise your muscles, you are exercising your skin. But on the contrary, when we do excessive movements with our faces, we're just pulling down on our faces.
Okay.
And that creates sagging and that creates loss of gravity. And that's what we're trying to prevent. It's the contrary to what we try to achieve with Botox.
Okay.
So face yoga is just doesn't make sense. There's no science to it. It's just an Instagram trend.
Yeah. Well, and I would guess this is different than myofascial exercises, something that a myofascial or even, some dentists will prescribe for like helping with their jaw and helping, so if people are listening to this, like if you're doing exercises for TMJ, if you're doing exercises because your dentist is like, this is going to help your airway, that's a lot different than what we're talking about with face yoga.
Totally. There's actually, there are several devices in the market that do muscle stimulation
Okay.
that are wonderful, but it's not the same as just making weird movements with your face.
I feel like we need to have like a montage of like weird movements with our face right now. You said layering on products can lead to inflammation. I know people that like stop some people right there. So tell us more about that, because I think a lot of companies will say like, here's our 5 or 7 or 12 step skincare routine. And it's literally like dozens of products they're asking you to use. So what's the problem with that? And like what products are like big no-nos? Like don't be layering those.
So the first thing is you said the company says you should do this 12-step routine.
Yeah.
The company doesn't know your skin. So the one size fits all, I think that's the first problem.
Okay.
Every skin is different. Every skin has different needs. The lemma of our clinic is understand your skin. Understand what your skin needs so you know how to treat it. Some people, the most common mistake we see is overexfoliation.
Oh, okay.
So exfoliants should be used maybe 2-3 times per week. That is way you maintain a healthy skin barrier because that's where it all starts. Having a good skin barrier will keep everything we want inside, which means hydration, plump, and preventing inflammation. When you exfoliate your skin, you get rid of the outermost layer, the stratocorneum. And that makes your skin look very nice.
Yes.
Because you have less texture, the pores look smaller, the fine lines are less deep. I mean, it's very nice. But when you overdo it, you inflame your skin.
Okay.
So unless this is prescribed by a physician, because I must say, I prescribe chemical exfoliants and retinoids on the same night on certain patients that I know can tolerate it or that have a specific need for it.
Okay.
But what I would not layer would be exfoliants with retinoids.
Okay.
So that way you can do 2 nights retinoid, 1 night exfoliant, 2 nights retinoids, 1 night exfoliant.
Okay.
This idea that more is more does not apply to the skin. Less is more. Start slow, start easy, and gradually progress towards harsher treatments. Being red is not a good appearance for your skin, and it's probably not good for your health either.
Okay. When you say exfoliants, I want to tease that out. What are we talking about? And what is the problem with things like apricot scrub? So people will say like, oh, I'm exfoliating my skin. When you ask, they're like, oh, I'm using like, the apricot scrub, which, anybody in that like grew up in the 90s, we were all marketed to nauseam to use this apricot scrub. But what's the problem with that? And then what are we talking about when you say exfoliants?
Okay, so I had a big thing with apricot scrub, and I'm partly blame it from my problems with the skin. So when we talk about exfoliants, we're mainly talking about chemical exfoliants.
Okay.
So basically, our cells stick together with this little cement that makes them stick together. Exfoliants, what they do is they dissolve that so the cells separate and shed off. If they don't separate, if they don't separate enough as to shed, they pull water inside and you get a very nice hydration.
Okay.
And this is something beautiful that glycolic acid does.
Okay.
This depends on the percentage of the exfoliant. We have AHAs, BHAs, BHAs. AHAs is alpha hydroxy acids, and that's mainly glycolic. Then BHS is beta hydroxy acids. These ones are particularly interesting because they are lipid soluble. What does this mean? They can actually go into your pore, get rid of the sebum, and exfoliate the pore. And this is salicylic acid.
And that will help with acne?
That will help with acne. Beta hydroxy acids are lipid soluble. This means that they can go into the fat, the sebum in the skin, and they can go deep into the pore and exfoliate the pore. This helps with acne, and it helps with blackheads and with comedones.
Okay.
And this is the salicylic acid, which is very popular. And then the PHAs, the polyhydroxy acids, gluconactone, which is meant for more sensitive skin. And that's actually what I prefer to use on the younger patients.
Okay.
So those are chemical exfoliants. And chemical exfoliants can be super mild or super potent in the kind of treatments that we do in clinic. Apricot scrub. So we also have physical exfoliants that we like magnesium, which you just rub into the skin and it kind of dissolves.
Oh, I like that. I've never heard of magnesium.
Yes.
Yeah.
Yeah. This can be wonderful. But the apricot scrub. So instead of having a beautiful sphere, it has spicules. It has like
So it's like jagged.
Yes.
Yeah. Okay.
So when you rub them against your skin, you are scraping the skin surface.
That doesn't sound good.
That doesn't sound good. That breaks up the skin. You inflame the skin. And when you create too much inflammation, that can lead to post-inflammatory hyperpigmentation, which makes everything just worse.
So that's where you'll get dark spots on your skin.
Yes.
Okay. Nobody wants that.
No.
Yeah.
Apricot scrub is a really bad idea. And getting into the home remedies, sugar and salt can be fine. But anything that involves seeds that are broken down is a really bad idea.
Okay. So, I'm going to ask you this question then and skip ahead. We had talked about this before, but what are some DIY treatments that people are doing at home that are completely sabotaging their skin?
Well, number one, the homemade sunscreen.
Oh, yes.
That's scary.
Yeah. Okay.
That's just scary. Number two, lemon. Lemon is a very bad idea for your skin. So lemon is an acid.
Yeah.
Well, we call it lemon in Mexico and lime in the States. But any kind of citrus.
Yeah.
Citruses have a specific substance that makes your skin more susceptible to the sun. They're called sorolens, and they're photosensitizers. So if you put any kind of citrus on your skin can literally burn.
Yes.
And you can get blisters from it. Baking soda. Baking soda is a very bad idea. It's harsh. It has a very alkaline pH. Not good for the skin.
Well, I want to, just for people listening, because you said limes, limon in Mexico, but the green ones. These are the ones that if you're ever making a margarita, right? People go to the beach, they make margaritas, and then they're like, why are my hands breaking out in blisters? They're like, and that's because of the reaction that's happening with the lime. It increases the photosensitivity. You have to wash your hands really well. So what I'm hearing from you is don't be putting that on your face and then going out in the sun, which if you're getting your vitamin D right, you're out in the sun every single day. We should be outside.
We should be outside, but this is an interesting topic. So the amount of vitamin D you produce from the sun depends on a bunch of things.
Yes.
Your age, your gender, your BMI, many things.
And the color of your skin.
The color of your skin, whether you're in Mexico or in a region or whatever.
Yeah.
So, and we do know that the sun is responsible for skin cancer. So the final evidence-based recommendation for vitamin D is to take it orally. Because that's the only way we can actually be sure that you're getting the right amount.
Yeah.
And measuring your levels.
Totally. Yeah. So we want to measure the levels. And if you're taking vitamin D3, you want to couple that with K2 because we don't want to be pulling calcium into the arteries. I want to ask you though, because people who are anti-sunscreen, and pro sun, they will say, some of the highest incidences that we see of skin cancer are coming from Nordic countries, and they're getting less sun exposure. So therefore, it's not the sun causing skin cancer. What do you say to that?
That is not true. That is just simply not true.
Okay.
Australians are getting like the number one country that has the higher incidence of cancer in the world is in Australia.
Absolutely.
And they're not Nordic.
You'll never meet an Australian that doesn't use sunscreen.
They understand the risk because, so the thing with cancer, skin cancer is the number one cancer in the world. We are seeing it in a much younger population. The non-melanoma kind is a kind that can be treated more easily.
Yeah.
But the melanoma kind, if we don't catch it early, we do not have a treatment. And people are dying of melanoma every day.
Yeah.
So to be going against some precautions, it just doesn't make sense. I can understand people not wanting to use sunscreen. I can respect that. But then wear a hat.
Yeah.
Stay in the shade and don't go in the sun.
Well, and there's also SPF clothing now. So living in Puerto Rico, like you won't catch me outside without a sun shirt and a giant sun hat. And my husband and I, it's so funny because we would be out with friends and we'd be the only ones like sun shirts. My kids like in a full sun jumper. We've got like big hats on. And people, everyone else is in their bikinis and people are like, why are you guys so covered up? And I'm like, I'm friends with too many dermatologists. That is why. So you brought up skin cancer, and I think some people that's going to raise alarms for them. How often should you be getting screened by your dermatologist? And what can you be looking for yourself for early signs of, perhaps skin cancer detection so you know to get to the dermatologist?
So everybody should have a full skin check once a year.
Okay.
If you are in a particular susceptible population, if you have a history of cancer or familiar history of cancer, then we should look at you maybe more frequently.
Okay.
Anything that doesn't heal, anything that grows, that ulcerates, that like it opens and it doesn't repair itself, it's something we should check.
Okay.
And in terms for moles, we have the ABCDE. This is the ABCD of melanoma. A is a symmetry. When you look at a mole, it doesn't have to be it doesn't have to be a perfect circle.
Yeah.
But it should make a mirror image when you fold it in half.
Okay.
B is for borders. The borders should be well defined. If you have a little leg sticking out of it, a little bite, like a little Pac-Man, that is something to look at. C is for color. Moles should be one color. If they have many colors in it, we look at it. D is for diameter. Diameter, if it's above 5 millimeters, which is the size of the eraser on a pencil, that is the mole we look at. And E is the most important one, which is evolution. A mole that changes, a mole that does something, is a mole that we should always look at. Two more rules are the ugly duckling. So some patients have many moles and they're all very ugly, but they all look ugly, equally ugly. When one is different, we look at that one.
Okay.
And the other one, and I had this recently happen at the clinic and it really struck me, is when a patient says, this mole concerns me, that is a mole we have to look at twice.
Okay.
A girl came in with a mole that she didn't like. She didn't know why she didn't like it. She just didn't like it. And I looked at it with my dermatoscope and it looked totally fine. And we removed it. And it was melanoma.
Oh my gosh. So wait, for everybody listening, did you just catch this doctor said, believe your patient? That if your patient says something's not right, then that should be listened to, because a lot of women experience gaslighting in medicine. It's a very common phenomenon. And so I just want to underscore, believe your patient. If your patient says, I don't know why, but something's not right, twice is the number of times that you're going to look at that. You said younger people are getting skin cancer. We're seeing more in younger people. What's going on?
Well, part of it is the early diagnosis.
Okay.
We have a machine at the clinic, which is called the Photo Finder, which is a skin mapping system that photographs your entire body and then takes dermatoscopical pictures of every mole.
Yeah.
And it has an AI system, which has basically took away my peace because it's diagnosing things that I would have never diagnosed. And we are catching very early melanomas
Okay.
on early stages. And if we catch it early, we cut it off and that is it.
Mm-hmm.
And that is it. And that patient's life was saved.
Yeah.
So yeah, I think there's a change in diagnosis, and also on the practices in the sun.
Mm-hmm.
People like the sun a lot.
It's true. That I love that you're using artificial intelligence. We're also seeing that with imaging, where radiologists are reading an image and then they're putting it through AI to like double check themselves. Like it's a way of like having a second opinion like built in. And I think that's just absolutely brilliant. I want to shift the conversation to talking about things that people can do, as they're aging to care for their skin. We have a lot of listeners that are in their 30s, approaching their 40s, or maybe beyond. What advice would you give them to start caring for their skin? Because maybe they don't want to go the route of using Botox or fillers. They just want to do things naturally. And I think there's a lot that can be said of having a good foundation, even if you do go that route of Botox and fillers.
So before the podcast, we were talking about how much habits impact life, health, and the skin health.
Yeah.
So I know this is super repetitive, but no sun. Yeah. We're done.
Wait, are you saying no sun ever?
I say no sun ever. Yes.
Oh, okay. Well, I'm going to disagree with that because I do like to get out in the sun. But
okay, so be in the sun, but like
be smart.
Be smart in the sun.
Yes.
Be smart in the sun. Use sunscreen. Stress inflammates our skin. So when we're stressed, from back when we were at the savannah and lions were chasing us, we release cortisol.
Yeah.
And cortisol makes our skin be pro-inflamed. That pro-inflammatory state makes our skin age faster.
Yes.
Number 3, sugar. So there's this concept of glycation. Imagine our collagen is like a beautiful, freshly made spaghetti. And it's super flexible. And you dip it in caramel and you let it dry. And then you try to move it around and it's going to break.
Yeah.
Glycation, which is what happens when we ingest sugar, makes our collagen fibers break much more easily.
Okay.
So as much as possible, take care of that. And antioxidants. Antioxidants in the form of topicals. For the people that really don't like sunscreen, this is more of a philosophical. No, I don't want to say that. I don't want to say that publicly, but we could argue that if you just use the antioxidants, you could skip sunscreen, which I'm not going to say because there's not enough evidence to say that. But when you use antioxidants, you help your skin repair from the outside damage. That's in the morning, and at night you repair what had happened. So it defends us in the morning and it repairs us at night. And antioxidants should be topical, but also orally. And it can be in the form of like supplement or orally in the form of food.
Yeah.
Like berries, vitamin C, all of that. Having a good diet is the foundation to healthy skin.
What's an ideal skin routine then that you're saying, during the day we want the antioxidants, at night we want to be repairing?
So you would be layering antioxidant, then whatever targeted treatment you need for your specific concern, and sunscreen.
Okay.
The moisturizer, it depends. It depends on your skin type. It depends on where you live. For example, in Mexico, that can be a little bit humid. Not everybody needs a moisturizer. And at night, you would be looking into retinoids, which are the gold standard for anti-aging, and peptides.
Okay. And when you say peptides, like what are people looking for? Because there's a lot of peptides out there on the market promising a lot of things.
So peptides, this is a new field. And as you said, it's a word that gets thrown around very easily. Peptides are like little messengers that go and tell your skin what to do. So it goes and says, act in a certain way. There's one brand that is called Elastin that has it.
I love this brand.
We love Elastin.
Oh my gosh. I'm so glad that you said that. I'm like, winning. I'm winning. Yay.
We love Elastin. So the Tri-Hex technology that they invented, it's really revolutionary because what it does is like it clears old collagen and leaves space for new collagen, which is very good as a maintenance treatment. It can go very well with injectables. And there's a particular one that is made for laser that has really changed the way I perform lasers because it cuts down recovery time by half of what it used to be.
That's amazing.
It
We're going
is.
to talk about lasers in a bit, but before we get there, I want to ask, are there considerations for menopausal women? Because we know that once we're entering into menopause, we have a drastic reduction in our collagen. Some are losing 30% of their collagen within 5 years, and then it just keeps plummeting. It's the worst. It's super lame. I'd like to hear, are there certain things that women can be doing in menopause? And what are your thoughts on using topical estrogen on the skin?
So the hormonal shift we have to embrace when we get to menopause is very important. The lack of estrogen will make your skin be, as you said, 30% in the first 5 years. That's a lot. And losing collagen means sagging, deep wrinkles.
Yeah.
But it also means that without estrogens, our skin barrier is impaired. So we start losing water and our skin gets super dehydrated. Our skin becomes more fragile and more susceptible to damage.
Yes.
So, what should we be doing? Number one, anything that will stimulate our collagen. Topically, we have vitamin C, retinoids, and peptides. And then in office treatments, it can go anything from as simple as peelings or microneedling all the way to lasers and radio frequency, HIFU. We have most of the technologies we have are directed towards that. Number two, a thick, heavy moisturizer. That will help lock in the water, not let things go out and not let anything come in, which will help prevent inflammation and dermatitis. Antioxidants and sun precautions are very important in this age group because since your skin can no longer repair itself, it is more susceptible to damage.
Yeah.
Topical phytoestrogens are very interesting. I do not have enough evidence-based information to make a proper recommendation for my patients. But this is something very, very promising because we can restore the youth of the skin by giving it phytoestrogens.
And so phytoestrogens, we're talking about plant-based compounds, putting those into creams, moisturizers, those potentially having promise. What do you think about, so people are doing bioidentical estrogen if they're a candidate for it and doing, it's a very small amount, putting that on their skin as a way to support the anti-aging process, but also the integrity, the health of their skin.
To be honest, I do not know enough about that subject to discuss that.
Yeah. Okay. That is fair. But what I do want to ask is that, so women listening, as soon as you said dry skin, they're like, I know, because they're itching all the time as they are in late stage perimenopause, entering into menopause. They've got itchy ears like crazy. The back of their scalp is itchy. You said a really great moisturizer, like a really thick, heavy moisturizer. What are people looking for?
Ceramides.
Okay.
Lipids. Cholesterol. But you know what? It's also very good.
Fats.
Fats. It has been proven that oral omegas help the skin barrier.
Yes.
So if you're very brave, the fish oil, or if not a capsule, will certainly help with that. And then there are a bunch of things that we do normally that destroy our skin barrier, which is hot water.
Yes.
Long baths, harsh soaps. The soap, we as dermatologists, we like the synthets, which are synthetic soap. It's soap without soap because that doesn't get rid of your lipid barrier.
Yeah.
So part of it is restoring it, but a big part of it is keeping it safe from the environment.
Let me ask you, there's like a big controversy that has happened on the internet with, there's been a few celebrities saying, I only wash with soap my armpits and then like my genitals and that's it. And then the rest I will scrub with like a washcloth and just water. And people are like, that is super disgusting. You have to use soap on your whole body. I want to hear it from a dermatologist. What do you have to say?
Okay, so my teacher in dermatology school said that we need to clean our body like an airplane.
Okay.
Under the wings, he was a man.
I like this under the wing.
in the motor,
Yeah.
he was a man, and in the switch.
Okay.
So yeah, soap. We only have glands that produce bad smell
Mm-hmm.
in our axilla and our is the genitals.
Yes.
This does not need soap,
Mm-hmm.
but it doesn't need a washcloth either.
Mm-hmm.
Because if you go like this with a washcloth, as gentle as it might be, you're gonna get rid of your lipid barrier.
Okay.
So what I would recommend is soap and nothing else. The foam and the water is more than enough, and it's
Okay.
not disgusting.
No, so I'm out myself. That's actually how I wash myself. And it is because of the research on the microbiome of the skin and reading that about how soaps are so disruptive to your microbiome and how that leaves you susceptible. So if you think that's gross, imagine that you don't have your own microbiome fighting what you're coming into contact with in the rest of the environment. So you get on a plane, you're picking up someone else's microbiome and you don't have your own to be like, you don't belong here. And now you've got other people's invaders. And that I find more gross and icky than anything else.
Our microbiome is a perfect system that works in a perfect homeostasis, just as is.
Mm-hmm.
We do not need to disrupt it, because when we disrupt it, the bacteria that live in our skin that are our friends can overgrow and become our enemies.
Yes. So thinking about like staph, that's
Yes.
the first one that comes to mind.
That
Staph
is the first one.
infections.
Yeah.
Yeah. So how can people care for the microbiome in their skin? Do they need to? Do they need to do anything different other than don't just like scrub yourself down and be lathering on all the soaps?
Probiotics,
Mm-hmm.
either via food,
Okay.
kimchi, kefir, or orally in terms of oral probiotics. They're
Yeah.
very important for our skin, for our gut health and our skin health.
Mm-hmm.
And the gut-brain skin axis has been very well established. It is important to have a healthy microbiome all over.
Yeah. And as we know, because I think that always throws people off, because we'll say the same thing with like vaginal health and we'll say, we'll take oral probiotics. And people are like, how is it getting from my gut? There is so much communication. There's so much we don't understand, but there's also so much communication. The communication piece is important, but also there's sharing of the microbiome. It gets shared. The gut serves as a reservoir for the lactobacilli of the vagina. And whenever I say that, people are like, ew. And I'm like, I know it sounds kind of icky. And yet you're perfectly designed. Like this is just the way it is. So I want to shift the conversation to fillers because there's been so much coming up on social media about fillers. And one thing we're seeing is that a lot of celebrities are starting to dissolve their filler. Like we saw, do you know Demi Moore? Yeah, complete transformation. Like, let's talk about like what even happened in that situation to begin with, and then why the trend of dissolving these fillers.
So I must start by saying that I love fillers.
Mm-hmm.
Fillers are amazing
Okay, why do you love fillers?
when done right,
Okay.
in moderation.
Mm-hmm.
A little filler here and there for beautification, for repositioning tissue, for enhancing certain aspects, a little bit on the lips, a little bit on the chin, really gives amazing results.
Mm-hmm.
What has happened is that the social media face, the Instagram face, has distorted the way we see beauty.
Yeah.
We are normalizing this alienized look,
Mm-hmm.
the cheeks, the jawline, the chin, the lips. And we're starting to think that that's beautiful
Yeah.
when it's not. There's something very interesting that I read recently that whenever there's like an obscene over the top result with fillers on Instagram, that gets a lot more views, shares, saves than a beautiful natural result.
Yeah.
And I realized it happened to me. If I see like this, there's this trend called the Russian lips, which are like enormous.
What are the Russian lips? No, tell us.
Russian lips, they're huge.
Yeah.
They do columns. They like completely change
So,
the
like,
anatomy of the lip.
Is this like the hot dog look where you got like two hot dogs flapping? Like, have you seen those lips that are like just big rolls?
Unfortunately, we have very bad injectors that have other things other than the best thing for the patients in their minds
Okay.
that overdo fillers.
Mm-hmm.
So we have all of these faces that are very recognizable that were deformed with fillers.
Yeah.
So I started by saying, I love fillers, but in moderation.
Mm-hmm.
You cannot do everything with fillers. You cannot refill every single line, every single fold with fillers.
Mm-hmm.
And this is something we have learned over time. This is one thing. And the other thing is, in order to have a good result with filler, it depends on the right technique. When we do fillers, there are a bunch of things we need to take into consideration. The face we are treating,
Mm-hmm.
it's an individual. We always have these diagrams of how to put on fillers. We have patients, we're not treating diagrams.
Yes.
So individualize each treatment for the patient's needs. Number one. Number two, choosing the right product
Mm-hmm.
and the right technique. So it has become evident that fillers do not dissolve completely
Mm-hmm.
over time. And we're starting to understand a little bit more of why this happens because in reality, fillers do dissolve,
Yeah.
like in the lab, but in the face, it doesn't.
Mm-hmm.
So,
Ever?
so what has been shown is
Yeah.
that certain aspects are making fillers stay there longer.
Okay.
And the number one is the biofilm.
Okay.
So when we apply fillers, it's not a completely sterile environment.
Mm-hmm.
We don't do it in an OR. To starters, when we open the syringe, the box itself is not sterile.
Yeah.
What's inside is sterile, but it's not a completely sterile technique.
Mm-hmm.
So when a bacteria enters and it coats the filler,
Okay.
it creates a biofilm.
Mm-hmm.
And that doesn't allow our body to dissolve the filler.
Mm-hmm.
Fortunately, we have an enzyme that we can inject on the face that reverts this process. And this is something I'm doing very often in the clinic. I actually started myself. I went to a course on injectables because I always like to keep updated. And looking around the room and seeing all the other doctors, I got dysmorphophobic and I was like, please take everything off my face. And I injected hyaluronidase all over my face to see what happened.
Yeah.
And it was very interesting. The only thing that went away was a filler I had on my under eye that had been there 5 years ago.
Mm-hmm.
I didn't even thought it was there.
Yeah.
So,
Right. Because the manufacturers tell us it's like 18 months, like 2 years max, but that's not true.
that is true in the ideal situation.
So true in a lab, true if everything's perfect.
True if everything's perfect.
Okay.
In terms of technique, product selection, and the biofilm thing.
Okay. So why are celebrities now? We're seeing more and more getting their fillers dissolved.
So the thing with fillers is you need to know when to stop.
Mm-hmm.
Because if not, you get the overfilled face.
Yeah.
What is the problem with HA fillers? HA fillers pull water. They're highly hydrophilic. That means that they will love water.
Which is why people use them, because then you plump up and they're like have a more full look.
Yes, but
Yeah.
as women, we tend to retain liquids just because.
Yeah.
And then you add that you ate sushi for dinner and you drank alcohol and you didn't sleep very well and you're dehydrated because you're at the beach. All of your fillers
Yeah.
plump up. So the thing with the overfilled face is using too much product, not waiting for the product to dissolve, and again, trying to fix everything with fillers. That's where we get into the energy-based technologies. Because when we use energy-based devices, we can reposition tissue, increase like the skin quality, do a lot, and then just sprinkle filler here and there.
Okay. When you say energy-based technologies, are you talking about laser?
So lasers are the ones that involve light, but we also have radio frequency, HIFU, which is high intensity focused ultrasound, LED therapy. So there's a bunch of ways we can use energy-based devices to rejuvenate our skin.
Okay. Well, I want to talk more about that. But you had said like the injector matters. I feel like everybody and their mother is like an injector now, right? Like you're just seeing, and it's so many different licensed practitioners can do these injectables. And I don't even know that the license matters as much as the skill, the technique, the training. So what can people look for? Like if they're like, okay, I do want just a little touch up of filler. I do want this moderate amount to get a little, a little plumpness, a little bit of more volume, but I don't want that overfilled look. So how can somebody navigate finding an injector?
I would say always look for doctors.
Okay.
The world in Mexico is a little bit different than in the States. So I'm going to talk specifically about how it works in Mexico.
Perfect.
Find either a plastic surgeon, a dermatologist, or an aesthetic doctor. Look up their credentials. Unfortunately, there are a lot of people pretending to be doctors that are not.
That's wild.
It's
wild.
That is wild. Make sure of what they're using. Look at so whenever we open a syringe, we show the patient like, this is new. This is the box. This is, it says allergen.
Yeah. Even when you get a blood draw in Mexico, they're like, this is nuevo. Like, see? Like, and I'm like, claro. Like, every time they want you to know that it is brand new, that the needle that they're going to use.
It happens to me with patients that they have been with me for a very long time that they don't even turn around. And I'm like, no, yes, please turn around. Look at, see that it's like do your job. Do your homework. Do your homework and make sure to know what it's being injected. Number 2 is the informed consent.
Yes.
There's nothing sadder for me than to see a patient come in and say, I got something injected into my face and this happened to me and I didn't know that it could happen. Informed consent is one of the most important things that came after World War II and all the horrible experiments that were done in the concentration camps. It's a human right to have an informed consent.
Great.
And so make sure, read it, make sure you understand it, ask questions, and make sure you're being with someone that is worth your trust. Trustworthy.
Yeah. I think that's important. Vet your injector. For, people who are like, well, maybe they don't even know what fillers are. You said choose the right material. So let's talk about what fillers are and what's like the pros and cons of it.
So when we say injectables, there's a big gap. So we have botulinum toxin, which paralyzes muscles.
Yes.
And that should be used specifically to target the muscles that pull down and decrease the negative emotions in our faces.
But negative emotions like frown, scowling.
Frowning.
Okay.
Botox is not meant to erase every single line or to completely freeze your forehead.
Yeah.
It's meant to decrease the negative expressions of our faces. There's abundant evidence regarding this. Using botulinum toxin can help in the treatment of depression.
Interesting.
So if you don't look sad and if you don't look angry and you look at yourself in the mirror and you don't see that creates a feedback to your brain that says, I'm not that angry.
Wow.
I'm not that sad. And it helps with the way you feel.
So smile every time you get in the mirror.
Yes.
Yes.
And I always tell my patients, háblate bonito. We need to speak nicely to ourselves.
Totally. Well, there's research that shows that people who engage in negative self-talk, it actually raises inflammatory cytokines in their blood. So there's a lot in the medicine of just talking pretty to yourself. So that's Botox.
That's Botox.
We're going to talk more about that. But
fillers. Fillers, we mainly have HA fillers, which is hyaluronic acid. Hyaluronic acid is a natural part of our skin, which in theory disintegrates over time.
Yeah.
And what it does is it pulls water. And we have different products made for every indication. So we have like super soft products for just hydrating, or what they're called skin boosters, which makes your skin look very nice. And then we have everything in the middle towards fillers that resemble bone. So we have everything in the middle. I would seriously disencourage people into going into anything that is permanent.
Okay. So is the bone like one permanent?
No. A bone one can be, it's like the one from Allergan is called Botox. It's just a very firm gel
Okay.
that there's something called the G prime, which is basically like, imagine it's jello. It can be like a firm jello or like a soft jello.
Oh, okay.
So this is like a firm jello that like really plumps, like gives you very nice projection.
Mm-hmm.
Then we have caja, which is calcium hydroxyapatite, which is wonderful because it can be a filler, but it's also a biostimulant.
Mm-hmm.
I personally prefer it as a biostimulant because we can inject it into the skin in a diluted way, which makes it a lot safer.
Yeah.
And it helps build beautiful collagen. So we have this product called Elancea. This is another type of filler / biostimulant that is very nice, that gives very nice projection and creates beautiful collagen.
Mm-hmm.
And the newer one we have, it's called Harmonica. I don't think it's available in the States yet. It's by Allergan, which is caja with hyaluronic acid.
Mm-hmm.
So it is a very nice filler that we can use to reposition tissue,
Mm-hmm.
create a biostimulant effect. And in the early stages, it gives you that fill effect, but it lasts up to 18 months. And over that time, what it does is it improves your collagen.
Mm.
And there's this very nice thing with them, which is the pinch test,
Yeah.
which is how much your skin retracts before and after.
Mm-hmm.
And then we get into PLLA, which is Sculptra. Sculptra, it's a powder that we dissolved in saline.
Mm-hmm.
We inject into the skin, and what it does is it increases the collagen production up to 30% in the next 3 months.
Oh, wow.
So it creates a beautiful foundation for healthier looking skin.
Mm-hmm.
We place it very strategically in the periphery of the face where we have the fixed face. So we pull back,
Okay.
and it's a great way to prepare the skin for lasers.
I really appreciate you spelling all that out because I think a lot of times when people think fillers, they just think replacement. And yet you just outlined all these biostimulants, which these are injectables that will encourage your body to replenish its collagen and to rejuvenate itself. And I don't know that that is talked a lot about. I think it's because in part, not all of these are available in the United States, which I find very interesting because you will see products go through rigorous testing and the EU will approve them, Mexico will approve them, many countries will approve them. And the United States seems to fall behind. And I almost feel like it's maybe on purpose so that you're just getting these, like, not to be a conspiracy theorist, but I don't think it is conspiracy when we live in a capitalistic market, as if maybe these companies want to corner the market and make sure that they are most profitable before something comes in that could actually help your body do it itself.
Well, caja and PLLA is available in the States.
Okay.
The thing is, the FDA, it's a very, very strange route because fillers get in approval for specific indications.
Mm-hmm.
Like the one that I said that resembles bone, it's only has the indication for jawline.
Okay. Okay.
So navigating the U.S. regulatory system is extremely complex.
Mm-hmm.
But I think all of these products will be available. Like Harmonica is by Allergan, so
Yeah.
it will be available soon. I think you said something very interesting because you said reposition. So in the history of fillers, before my time, first they would just fill the lines.
Mm-hmm.
So they would fill the nasolabial fold, fill it, refill it, and then you would get the
Yeah.
face. And then it was reposition tissue. But if we rely solely on the filler to reposition filler, you get the overfilled face.
Mm-hmm.
And that's where energy-based devices and different types of technology can really help lift the face
Mm-hmm.
and body, and then allow us to use the fillers in a very strategic way.
So how are you using these then with filler, these energy-based techniques?
So what I like to do is prepare the skin with Sculptra.
Mm-hmm.
PLLA is one of the most studied biostimulants. It started in the 90s as a treatment of the lipodystrophia associated to AIDS medicine.
Mm-hmm.
So it's a product that has been around for a very long time, and we know how it works. And We're still learning all of the amazing things it does.
Yeah.
So if you use a PLLA Sculptra a few months before we do any kind of laser, we are kickstarting the collagen production.
Mm-hmm.
And then the way energy-based devices work in a very minimalistic manner is they create micro injuries, controlled micro injuries in the skin
Mm-hmm.
that will make your own skin repair itself.
Yeah.
And by doing that, it will increase the production of collagen and elastin,
Mm-hmm.
which means you make your own skin be healthier.
A lot of people know what collagen is, but maybe not elastin. Can you explain that?
Yes. So collagen is the big hero of the youthful face.
Yes.
But elastin, it's the Batman and Robin to the face.
Oh, Batman and Robin. I love it. I was like, Robin Hood?
Who's Robin?
No.
Who's Robin? Yeah, no. So elastin, collagen gives you firmness.
Yeah.
But elastin is what makes your skin come back.
Mm-hmm.
Tonight, go and check your baby's skin. When you go like this, it immediately comes back.
Yeah, yeah.
That is elastin.
I don't know if I want to do this side by side. I might be in the mirror going,
So when we lose, and when you think of an older person, you go like this.
Yeah,
and
and it
just
comes
stays
with
crinkly.
you. Yeah.
So that is elastin. Elastin makes our skin sag. And the only topical product that has shown to increase the elastin production is the trihex from elastin.
Okay.
So producing elastin will make your skin bounce back.
Mm-hmm.
And so that is very important because we want collagen. We certainly want collagen, but we also want elastin.
Mm-hmm. And so you were saying using these like laser techniques, this energy technology. So you're using the biostimulator, and then a couple months later, that's when you come in with the laser, correct?
Yes.
Okay.
So I first prepare the skin with the trihex, the elastin skin nectar,
Mm-hmm.
which is a complete game changer when we talk about lasers. We prepare the skin for about 2 or 3 weeks, and then we perform the laser. And after the laser, you continue with that, which helps the recovery process. Like the study takes downtime by half.
Okay.
So instead of going to 10 days, we're talking about like 5 days.
Mm-hmm.
The beauty about lasers is that we have always thought about lasers in terms of rejuvenation and wrinkles.
Mm-hmm.
But what we are learning now with biopsies and further animal studies is that laser restores skin health.
Mm-hmm.
It makes the skins. So we have these cells in our skin that are called senescent cells.
Mm-hmm.
These are like little zombies.
Yep.
They consume energy. They don't allow the cells to act the way they should act, and they create a bad environment in the skin that makes everything age. These cells are particularly susceptible to laser.
Mm-hmm.
So when we apply, I like to call them magic bullets because light is electrons. They're like magic bullets that are super specific for certain things in the skin.
Yeah.
We can create these micro injuries that will destroy the bad cells
Mm-hmm.
and make the good cells reproduce. So the main thing about aging is losing function
Mm-hmm.
and accumulating damage. So by doing this, we restore the function of the skin and we eliminate the damage. And when I talk about eliminating the damage, there's this very interesting study. It's talking about non-melanoma skin cancer, but doing laser resurfacing can decrease the risk of developing non-melanoma skin cancer by 30%.
Wow. That's significant.
Yes, because we are
Yeah.
eliminating all of that damage,
Mm-hmm.
all of those mutations. So
Misbehaving cells, kick them out.
exactly, we're evicting the
Mhm.
bad cells, the zombies.
When you're talking about laser treatments, like what should people be looking for in terms of like, are there specific devices, specific therapies?
So there's a specific laser for each need.
Okay.
So, for example, we have specific lasers that are for vascular things. A part of aging is having a lot of redness and telangiectation, like the broken capillaries. So, pulse eye laser is the go-to treatment for that.
Okay.
In terms of pigmentation, we have the picosecond lasers, which are specifically directed toward pigment, endogenous, our own pigment, or exogenous. It can be done.
So this is like
for-
melasma, what women get in pregnancy if they're on birth control pills or if they've been using their apricot scrub. Am I correct?
So
The like dark pigment?
you got into kind of a tricky subject because
Okay.
melasma is a disease we do not understand.
Mm-hmm.
We do not know what causes it. We have a bunch of ideas around it. It was thought to be more about estrogen. Now it's thought to be more about progesterone. It's thought to be it's a disease of photoaging, of like the accumulated sun in your skin. But since we don't know exactly what causes it,
Mm-hmm.
we don't have one specific way to treat it.
Okay.
I'm going to start by saying that melasma should not be solely treated with laser
Okay.
because it can really go bad with lasers. Because if you heat melasma, it can turn much worse.
What about vitamin C, glutathione, those kinds of
Those are amazing.
topicals? Okay.
Those are amazing. There are protocols. I do a specific protocol in the clinic where we use LED therapy, then the B-beam laser with a pulse eye laser, and then picotoning for melasma, which is a great way to really bring the pigment down really fast.
Mhm.
But it has to be in conjunction with topicals
Okay.
and sunscreen.
That's
sunscreen.
Melasma is definitely one. I mean, if somebody's listening to this right now and they're like, yeah, I don't know, like sunscreen good or bad. If you have melasma, if you want it to get worse, don't wear sunscreen and you will have worse melasma. Like that's the only guarantee. I think that's like definitely one that I have seen people online and it's raised concern where people are like, well, isn't sunscreen toxic? And it's like, you are also talking about how you got melasma. You used to get really bad sunburns and you have all these skin issues. And so that's where it's like, friends, go see a dermatologist. Have an individualized conversation rather than the one size fits all sensational, like, thing that the influencer gave you in a 15-second reel.
I have two things to say about this. So
Say it.
the thing about sunscreen being toxic, this was based on a rat model where the sunscreen was injected. We have a
Let's
bit.
not do that.
You're not a rat and you're not injecting it. So
Yeah.
I think you should be fine. Number one. Number two, the study was made thinking of people using the right amount in the entire body surface over a long period of time.
Mm-hmm.
If we have a problem is that people dab their sunscreen here and there. Nobody uses sunscreen in their entire body every single day.
Yeah.
So I think the New York Times was kind of irresponsible with that article. And I love the New York Times, but okay, that's the first thing. And the second thing is for the melasma patients, unfortunately, you cannot solely rely on sunscreen. It's
Okay.
sunscreen, it's your hat, it's the sun visor, and it's oral antioxidants.
Okay.
So there's one called Polypodium leucotemos.
Okay.
In Mexico, it's called Heliocare caps. I think it's available in the States. It's, but I don't know the name. So Polypodium leucotemos was developed for people with skin cancer.
Mhm.
And it's an antioxidant that repairs whatever is happening in the skin
Mm-hmm.
with the sun. So that
So this is an oral antioxidant?
it's an oral antioxidant.
Okay. Okay.
It's
and
oral sunscreen.
okay.
It's not sunscreen. It doesn't replace sunscreen, but it's oral sunscreen.
Astaxanthin?
It's another one.
Okay. Okay.
It's another one. This is
Yes.
Polypodium leucotemos. Then you have salt, superoxide dismutase,
Mhm.
which is an amazing antioxidant. There's a brand called Glycodine, and they have DSB formula, which is specifically made for melasma. It also has a lycopene, which is another form of oral sunscreen. You have glutathione. You have a bunch of oral antioxidants. So
Mhm.
when we're talking about melasma, is sun precaution, which is sunscreen and avoiding the sun, oral antioxidants, your skincare routine, and then we can talk about lasers. The very interesting way picotoning works is so pico lasers deliver the energy in super, super fast manners. So it creates very little heat, which is something that melasma doesn't like. So the melanocyte is like a little octopus.
Okay.
It's a dendritic cell. So when we pass the laser, we shorten the dendrites, which makes the spot itself become smaller, and it breaks down the melanin particles, which makes the dark spot become lighter much faster. And this is a wonderful way to keep melasma clear. I personally have melasma, and to be honest, I do all of it.
Yeah. So I had melasma. I'm going to tell this story. I had melasma. I had bought this device that was supposed to be like this skin rejuvenating light laser device, and I was using it on my forehead. And it was like, oh yeah, like use it, the more the better. And it wasn't even subtle. It was almost like an overnight thing. I woke up and I had just this horrible melasma on my forehead. And then I moved to Puerto Rico, and like, that's not good because there's so much sun, but it was sunscreen, definitely wearing hats. I've always done lots of antioxidants, but whatever I did to my skin, I overdid it. But it was topical glutathione and vitamin C that like really took it away. I didn't know of any lasers. No one was talking to me about lasers. My dermatologist that I had there didn't talk to me about lasers, but I stopped the glutathione because that can bleach your skin. Am I correct? Yeah. So I stopped the glutathione after that, but I am like religiously always about the vitamin C, and I'm always afraid that's going to come back. So in some cases it can be reversed, but I think the worst thing you can do is try to go it yourself and try to figure out how to reverse melasma yourself. Am I correct? Like, I feel like just the more DIY, I mean, DIY is like how I got there to begin with.
So inflammation leads to post-inflammatory hyperpigmentation. So if you have melasma, you're prone to it.
Yeah.
So if you inflame your skin by applying God knows what, you're going to do that. It's interesting what you said about the light. So LED therapy is very in fashion, and I really like the masks in 99% of the cases. If you have melasma, do not put red LED therapy on it because it will make it worse.
That is really solid advice. So, but we were talking about lasers. We took this like melasma little journey, and I love that we did because I think it's going to help a lot of people. But I feel like I stopped your role in talking about all of the ways that lasers can help our skin.
So, the micro injury created by laser will stimulate collagen.
Yes.
So that gives us firmness, which helps with wrinkles and so on. And then by killing the senescent cells and by getting rid of all that damage, we improve our skin's health. And with the pigment and vascular laser, we can reach this term. I love this term, normalization. Bringing the skin back to normal. And there is a normal to the skin, which means less red, less brown, less discoloration. There's this term in dermatology called poikilodermia, which is white, brown, red. When you have all those three colors combined, and then underneath we get a little yellow, that makes skin look really old.
Okay.
And with laser, we can get rid of all of that.
When it comes to laser, are people using this? Is this like every 3 months? Is it once a year? Like, what are the protocols typically?
So it really depends on the patient's needs. And this kind of treatments really need to be individualized for each patient. The way I like to start is, as I said, PLLA, Trihex, Sculptra, Elastin Skin Nectar. We do a laser treatment, and I usually never do resurfacing before 3 months because we need to let our own body react to the laser.
Yeah.
So we do as many sessions as necessary to achieve, let's say, the result that we want. And after that, we have maintenance therapy maybe once or twice a year.
Yeah.
Choosing the right type of laser depends on the patient's needs, but also on their lifestyles, because we have the ablative lasers, which literally disrupt a column of skin. which are the most effective, but with the most downtime. And we have the non-ablative ones, which are very beautiful. They're a little bit slower in showing results, but have less downtime and are more compatible with people with like very busy schedules. I actually have a device, the Yama Hybrid, which has both in it together.
Okay.
So we can synergistically use the two energies to target different aspects inside the skin to tailor the treatment for the skin of the patient.
Are lasers painful?
I'm going to say that with a good topical cream, oral analgesics, oral,
Analgesics, yeah.
oral painkillers, and we have this beautiful device that cools the skin, it is very tolerable. I personally do not do lasers under anesthesia.
Yeah. Well, I will say, I think Mexico does pain management right. I've seen it in so many ways and so many, I've done a lot, but, you offering oral pain meds, making sure that there's a cream that's going to help reduce the pain, and then doing the cooling after is something that people should be looking for or talking to their provider about if they're going to have a laser treatment, because people have shared online like how excruciatingly painful their laser procedure was and how they'll never go back. And that's always my thought of like, was pain management discussed ahead of time? And so I think it's always a good question to ask, will this be painful and how can we mitigate that?
Well, I must say that pain varies from patient to patient.
Sure, it's totally subjective.
It's
your
totally
tolerance.
subjective. Yeah, and the pain threshold of different people is very different. So what I might say is not that painful, might be very painful for a patient. I don't like to do anything that is very painful. Like I literally suffer with the patient while I'm doing it. So I always try to have patients be as comfortable as possible. And I also think it's important to raise your hand and say, hey, this is too painful. Can you please?
Yeah.
And what we do is we decrease the energy.
Does that make it less effective?
It depends. Sometimes it does.
Okay, because I think maybe that might be why a patient's like, well, I don't want to say anything because I want to get my money's worth right now. I'll suffer through it.
Well, there was an interesting article published recently that said, when we said more is more is not necessarily more when it in terms of the energy we use and the results we get with laser. And then in that same article, they talked about patient satisfaction.
Yeah.
So if it was very painful and they had a beautiful result, but the patient had suffered through the process, they didn't appreciate the treatment.
Oh.
And we also have the contrary, no pain, no gain. Bring it strong. I want to feel it. And everything in the middle.
Yeah, no. I want to go back to the Botox conversation because there's a lot of people who have concerns that it's a toxin and that it's going systemic and that maybe it's affecting their brain health or it's affecting them in some other way. What does the research say?
The number one aesthetic treatment in the world is Botox.
Okay.
Botulinum toxin. It is the safest in terms of less complications, and it lasts for 4 months. It only lasts for 4 months.
Yeah.
So the botulinum toxin we inject to this muscle has a diffusion halo of 1 centimeter. No more. What I inject here doesn't go here. It doesn't drop your eyelid. We know that Botox, it's very target specific. If we have a problem with Botox, is that it's lasting less. Because since we're doing it more frequently, we get more antibodies and it's lasting less.
Okay, so you said every 4 months it lasts, but if somebody's doing it more frequently, they can actually, their immune system will break it down faster. They can, over time?
Yes, so there's a curve of antibodies.
Yeah.
So you inject it, and we do the touch-up always before day 21st, because after that, your antibodies start peaking.
Okay.
If you apply toxin while your antibodies are high, you're going to produce more antibodies, which means that your next application will last less.
Okay, so you can build up tolerance basically to let me say that. You can build up resistance to Botox. What are some things that people can do to make their Botox last longer or have a better effect?
Zinc supplements.
Zinc.
Yes.
Okay, tell us about it.
You start before and you continue it throughout, and that helps the toxin lock itself better to the receptor. There's another study that says that when you get the injections, if you make facial exercises,
Wait, face yoga?
but only on the upper third. Yes, you do face yoga for that week. It latches better.
Okay.
And avoiding heat. Heat breaks down the toxin.
Okay,
So
so
hot yoga,
hot yoga, hot showers, sun exposure,
sun exposure, saunas,
saunas.
and
That's good to know because I'm a big sauna fan.
continue to be. Saunas are very good for our health.
Yeah. So it's just in that first week that you would avoid the heat exposure
No, it should be throughout the entire duration.
for 4 months. Sorry to my sauna people who are also doing Botox. Keep your sauna up.
Keep your sauna. Keep your sauna. Just realize that. Well, there's also something very interesting. So we all like the soft Botox.
Mhm.
I like soft Botox.
Well, what do you mean when you say soft Botox?
What we call baby Botox, right? So it's
like not Kardashian Botox.
exactly
Yeah.
for you to move your entire face, and specifically on the forehead. I like to only sprinkle it here and there to have a lot of movement.
Yeah.
And when we do that, so duration is directly proportional to dosage.
Yes.
So if we do very little, it's going to last very little.
Mhm.
And it's something you need to evaluate. Do you rather have to go in just twice a year and have a super frozen effect?
Mhm.
Or maybe do it a little more frequently, like 4 months, which is a recommendation, but look more natural.
I want to talk about face taping because people, you giggle. Okay, I think I know your answer, but I'm going to ask it anyways. People are like, don't do Botox, face tape instead. Does face taping give you the same effect?
Of course not. So I must say, we're living under two realities: the social media reality and the evidence-based science reality.
The real world versus like the social media, where I have to say, sometimes you see people saying, oh, just, use X, Y, and Z. And I'm like, I can see you have a filter on. You literally have a filter on right now. Like, I don't know. I'm not savvy enough to figure out how to take a filter. Like TikTok puts a filter on my face and it'll be weird because I have like this little mustache where I'm like, what is that? Like, it's a filter. I don't know how to get it off of me. And I'm like, the default of TikTok, if you record a video there, is to have a filter. But you will see like influencers saying like, oh, I just did these things and now look at my skin. And I'm like, you clearly have a filter on. And no shame if you want to use filters, but don't act like your face yoga, your face taping is doing what the filter is actually doing.
I think something that has always happened, but now with social media is more evident, is that we always want one quick fix to all our problems.
Of course. Yes.
So instead of diet, exercising, a healthy mind, a good skincare routine, going to your dermatologist 3 times a year, so on and so on, take duct tape and put it on your face.
Yeah.
O sea,
wait, but duct tape works for warts.
well, that is different. That is different. And that is a very interesting study because, o sea, apparently it's more like a placebo effect thing.
Yeah.
But yeah,
No.
if your child has warts, and removing warts from children, it's so horrible because they suffer and we all suffer with them and it's not nice. Yeah, duct tape for warts can work.
Yeah.
But not on your face.
No, not in your face. And for people that are like placebo, it's because you draw so much attention to it. The thought is that then your immune system follows and throws down on that virus. But face taping, does it have any benefits?
No.
Okay.
No.
Good
You can
to
use
know.
it like if you want to do your makeup and you want to do like the little tapey thing for the eye.
Yeah.
But yeah, no, taping your face.
Okay.
No.
And what about when you see somebody that is like, I had Botox and it caused severe headaches, or I ended up having like drooping eyes, like I had these side effects. Are those side effects that we expect, or is there something more going on?
No, those are side effects that can happen.
Okay.
So the thing with headache, I said that doing face yoga can make your toxin latch on faster. But that can also create a headache because as you stop moving your forehead, you start moving your face with your scalp, the muscles in your scalp, and then you get a headache. So yeah, headaches after Botox can happen, tends to be transitory. Halitosis. So this is one of the most feared effects of toxin. That is that it migrates. So we have this very, 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 very thin, very, very tiny muscle that lifts the eyelid, and we inject right there for the corrugator, so the toxin can migrate. I always explain to patients that it is a risk.
Yeah.
I've been injecting people for 10 years, and it has happened to me twice.
Mm-hmm.
Complications are part of doing something many times. But there are things we can do to make it better. There are specific eye drops that help stimulate another muscle that pulls up.
Okay.
And then we have this amazing technology called Ultraformer, which is a high intensity focused ultrasound. And we can use it to lift the eyebrow.
Mm-hmm.
So it has happened to me twice. The both times we did that. And the results were almost unnoticeable, except for the patient, because when you know your face, you see it.
Yeah.
But yeah, this is not, it's not your injector's fault. It can be dependent on the technique.
Mm-hmm.
And we always try to take safe margins. But as I said, we treat individual patients
Yeah.
that may not match the anatomy on the book.
So you were saying touch-ups happen about 3 weeks later, like within that 3-week
Yes.
window. So if somebody was concerned about this, could they ask for less and then always come back 2 weeks later if they're like, okay, I think I need a little more?
Whenever I treat a patient for the first time, I always act like that.
Okay.
I hate when patients come back and say, I feel frozen. It's a horrible effect.
Yeah.
I much rather they come in and say, give me a little more
Mhm.
than to feel that they had too much.
Okay. Botox, fillers, and I think laser as well. We can't be doing these in pregnancy, correct?
So, nobody will perform a study on a pregnant woman.
Yeah.
So there's not one single study that says that any of this is safe.
Mm-hmm.
And as a mother, the most important thing is your child's well-being.
Yeah.
So having a little wrinkles for 9 months is just a thing you have to deal with.
Mm-hmm. Well, let me just say this. If people are like, why are they not studying pregnant women? Because sometimes people are like, that's not fair. And I say, a baby can't opt in. A baby can't say, okay, sign me up for this trial and maybe this ruins my entire existence of being. So we're very, very cautious with that. But for women who are pregnant and, so we're seeing more mothers over the age of 35. Like if I get pregnant again, I'm going to be 44. No retinol, no nothing, right? Like none of that stuff to help me out. And because of our age, collagen's already declining, elastin, we're not snapping back the same. What can pregnant women do to care for their skin?
So we have AHAs.
Okay.
So the exfoliants are safe. AHAs and BHAs are safe. Peptides are safe.
Okay.
And it's a pregnancy pause.
Mhm.
It's 9 months. I always tell patients, the moment you will have a baby inside of you, come and see me.
Yeah.
And we can do everything.
Mm-hmm.
It's just 9 months. Patience. Realizing what matters and what comes first, which is your babies and your own health.
And with these exfoliants, can you be more sensitive in pregnancy to them?
Well, this is very interesting. So the skin changes with pregnancy.
Mm-hmm.
The dry becomes oily, the oily becomes dry, and everything in the middle. Our immune system has to navigate pregnancy in terms of accepting the baby and in terms of increasing the immune response to other things to protect the baby. So yes, the skin can become a lot more sensitive with pregnancy. So just take it slowly.
Mm-hmm. And when do you recommend? So if women are pregnant, should they have a dermatology appointment to help with their skin? Because, all kinds. So melasma, we talked about that can come up. Some women get reddening. Some women get rosacea. Like we can see things that can make women feel very distressed. And so what would you recommend in terms of care?
So for all my patients, the minute they're pregnant, because they always text, I'm pregnant. What should I do? Come in.
Yeah.
So they come in and we first discuss their skincare.
Okay.
We review all their ingredients, all the products, review all the ingredients, make sure that everything they have is safe. How much of whatever you apply on the face is being absorbed and can cross the placenta and get to the baby? I don't know.
Yeah.
But I won't risk it. That's number one. Number two, I explain all the changes so they know what to expect. For example, you're going to have beautiful hair
Yeah, but nobody's doing that. So I love this. I love that you're doing that.
You're going to have beautiful hair.
Yeah.
Afterwards, you won't. So
Yeah.
let's start with a good shampoo to encourage hair growth. And I always do a mulch.
Mm-hmm.
So the hormone they test on your skin, on your blood to see if you're pregnant, structurally resembles the hormone that stimulates the production of melanin.
Okay.
So everything pigments, and this
Mhm.
is for a beautiful reason. You know how when babies are born, they only see black and white.
Yeah.
Our nipples are supposed to become darker so they
Yep.
can find them easier. So this is a nice justification to understand that your nipples get darker, and it's not nice, but it's good. It's for a good cause, and everything becomes darker, including the moles.
Mhm.
So I always like to do a mole check at the beginning of pregnancy.
Okay.
We do the photo finder. We map everything. So in case somebody comes in at month 6 and say this looks weird, we can objectively see if it's actually weird or not.
Mhm.
Because with pregnancy, all the moles change and become a little bit like darker, more pigmented, a little bit more scary.
Okay. All right. I love that. So, meeting with your doctor, reviewing all the skincare that you have, getting the lowdown on what is going to happen. You brought up postpartum hair loss. Everybody, I have heard from patients and they're like, can I just start Minoxidil? Can I like start Rogaine? Like, because my hair's falling out. What can women do postpartum for that hair loss? And why does it happen? Because it happens to everybody. And anyone that I've seen people say, like, no, I didn't have that. I don't know why you had it. I'm like, liar, liar, pants on fire. Everybody has this. Otherwise, like, you're a mutant. Something's wrong. So why does it happen? What can people do?
So it's called effluvium telogenum.
Mhm.
To be honest, I did not understand the level of stress it causes till it happened.
Yeah. When you're like, why do I have
You go-
receding hairlines? Yeah.
And you take a shower and you have a hairball like this, and it's super scary.
Yeah.
So you give birth, whichever way you give birth. That is a very stressful process for the body.
Mhm.
And whenever we enter a stress process, a stress moment in our body has to manage the resources.
Okay.
So what comes first? Brain, heart, kidney, la 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 la. And at the end of the list, you have the hair.
Mhm.
So first you have the trauma, the stress of childbirth. And then the stress of producing milk,
Yes.
which is it requires a lot of energy from our body.
Mhm.
So our hair cycle has a growth phase, a transitionary phase, and then a phase where it falls off.
Mhm.
What happens after pregnancy is that all the hairs that were supposed to fall off enter at the same time into the telogen phase, and everything falls out at the same time.
So everybody listening, your hair's cruising around, grow, 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 and then all at once it decides, let's just shed.
And it all sheds at the beginning.
Yes.
What is very important to understand is the word cycle.
Mm-hmm.
A new hair is down there and it's going to come out
Yeah.
with time and patience. And there are things we can do to make it stronger. So minoxidil is not recommended during lactation.
Mm-hmm.
I don't know if you saw this articles recently about babies getting hypertrichosis,
Oh my
like
God.
wolf babies.
Yeah, wolf babies. That reminds me, like when I was a kid, there, like in the grocery store, there was the Inquirer magazine, and there was always like Bat Boy and like what wolf baby, and like that's what it's giving me. People can comment, let me know. Do you remember these?
And this has been shown with the mother and the father. Like if the father uses topical minoxidil and then hugs the baby,
yeah.
they get the minoxidil into them.
Yes.
So yeah, we usually wait with minoxidil. Minoxidil can also be oral,
Mm-hmm.
but this should not be used during pregnancy.
No pregnancy, no lactation.
no
So as
lactation.
long as you're breastfeeding, no minoxidil.
And afterwards, and we have a bunch of other things we can do. There are supplements that can help with the hair.
Mm-hmm.
There's shampoos for it. And a tip I always give my patient, I did it myself. It's cutting your hair.
Mm-hmm.
It won't help with the hair loss, but it does help with the stress of the ball of hairs you see in the shower.
Yeah.
Because if you have less volume, you will see less. And I think that stress causes more hair loss.
Mm-hmm. So when you say supplements, what kinds of supplements can help?
So the first thing would be to check your iron levels
Mm-hmm.
because after giving birth, you can have anemia.
Yes.
And if you have anemia, your oxygen doesn't get to where it has to go. So it would be to check that. Eh, it's always good to always check the thyroid function to make sure everything's okay there. Because if it's not, your hair is not going to be okay.
Everybody who has hair loss, those are two things you should be checking anyways, even if you're not pregnant. I just want to underscore that. What about derma rollers?
So derma rollers, microneedling, it's an amazing way to stimulate the production of collagen
Mm-hmm.
and introduce substance to the skin.
Mm-hmm.
We do it in the clinic with a machine that instead of rolls, it stamps. So instead of having like this shape, you have like a
This
nice
is for the
column
hair or this is the face?
for everything.
Okay.
I am really concerned with derma rollers at home and how clean they can be.
Yes, that's my concern as well.
Yeah.
Of like, if you're not cleaning them between use, like if you don't have the means to clean it, don't use it. But I wondered, is there any efficacy to it? Will
Yes.
it help?
Yes.
Okay. So it will help, but clean it, ladies. Clean it.
Clean it, be mild with it. So the idea is when you create the micro injury, you start the repair process of the skin, which enhances the blood flow.
Mm-hmm.
And this is kind of the similar mechanism in which LED therapy works for hair loss.
Mm-hmm.
So it does work, but I personally do not recommend it for patients because
Okay.
I know what weird is the infections in the scalp.
Yeah. And so you just mentioned LED. So like the ball cap LEDs, those can help with
Those
hair
can
loss.
really help
Okay.
if you use them.
And if you're not pregnant, then you consider going the minoxidil route. Do you prefer topical or oral with women?
So the study has proven that they're as efficacious.
Okay.
So this is a conversation. Who are you? A person that prefers to take a tablet at night or a person that prefers to put on a spray at night?
Okay.
As a minoxidil user, I must say that is kind of, I don't know, bothersome to put it on and you have to put it and massage it and then wash your hands and your face because if not, you start getting hair all over.
Yeah.
So I think with the oral, we have better usage from the patients and better results, but they're as efficacious.
Yeah. So better compliance with
Better
the
compliance.
oral. If somebody is on oral minoxidil or the topical and they decide to get pregnant, when do they have to stop? Is it like as soon as they know they're pregnant? Is it 2 months before? Are there actually any guidelines on this?
I actually do not know.
Yeah. I think that's why I was like, are there actually any guidelines? Because I'm like, I actually haven't seen that. Like, we know with like GLP-1s, they'll say 2 months before. With retinols, it's like, if you're trying to conceive, like you should stop that. But I actually haven't seen anything on that as well. But I would imagine you stop, you're going to see some hair fall.
Yes. So now for that thing, there's a formula.
Mm-hmm.
I don't know. I don't remember it from the top of my head. That is the vida de eliminación media, the mean elimination time, times a lot,
Yeah.
like 40. And that is how fast you need to get off it. So minoxidil can cause shedding at the beginning because it makes the hair cycle go faster.
Yeah.
So the little hair that was about to fall will fall, but a new one is coming. So have no fear. And yes, today, all the treatments we have for hair loss are only effective during treatment.
Okay.
So it's very common for people to come in and say, I stopped minoxidil and all my hair fell off.
Mm-hmm.
And I always have to say, well, it's not that all your hair fell off. It's that all the hair that was maintained thanks to the minoxidil over the last 10 years, when it stopped having the stimulus of the minoxidil, didn't have enough oxygen to continue growing.
Mm-hmm. Okay. So you can expect it to fall out, but you can always get back on it after you're done breastfeeding, but you have a baby in the meantime. Also, I think I think when you're a new mom, at least it's true for me, like when I've got a newborn, my hair is up in a bun and I'm not even paying attention anyways. And then it's like a hat and like, it's like I've got spit up everywhere right now. So this has been an excellent conversation. We have covered so much. I think there's something for everybody in today's episode. Is there anything you want to leave listeners with that you wish that everybody knew about their skin?
So we are very fortunate to live in an age where true skin rejuvenation is possible. We have the science, we have the technology, and we understand how to use all of these devices to rejuvenate the skin. And it's not about chasing youth, it's about being healthy.
So well said. Well, thank you so very much.
Thank
I
you for
appreciate
having
you.
me.
Yes, I'm like, we should do this again. I had such a good time.
Me too. Thank you for your time.
I hope you enjoyed this episode. If this is the kind of content you're into, then I highly recommend checking out this.